I've never felt anything that squishy on me. And I also didn't realize, which like, just if somebody had said, hey, think about it. My whole life, when you sit down, your abdominal wall holds all your organs in place in your body. You know, like you might have a little hangover, whatever, but like there's a structure there.
Yeah, yeah.
And after I didn't have, like, it felt like my organs were just coming out, like spilling out over my pants. And I remember feeling like, oh, I'm like, it's like if you put soup in a Ziploc bag, it just sloshes around everywhere, like instead of a Tupperware. And that's what I felt like. I felt like I was no longer a container. I was just a Ziploc bag full of goo.
Yeah, and then I brought all these clothes to wear, and I was like, I can't wear any of this. I can't do any of this stuff. Yeah. And I was like, I'm going to wear these, like, biker shorts. I'm going to be good to go. Because you see moms that come out, like, on those TikTok videos. They're like, we're ready to go home. And, like, her hair is done. And her makeup. I was like, I'm going to get the whole matching. No. The matching set did not work. No. I just wore my robe the whole time.
I wore the hospital gown the whole time.
I didn't. I wore the
I brought socks because I brought so much stuff the first time. It was unreal.
Yeah, I did too.
I didn't use 80% of it. But I just wore the hospital gown and the little socks they gave me the whole time. But yeah, and I remember the mesh. I actually love the mesh underwear.
Me too.
It was so comfortable, and it didn't squish in on my squish so much that I felt uncomfortable.
Yeah. No, I really liked that. And the huge pad they had with the ice in it.
Yeah.
I made my own at home, and I was like, nothing still compares to the hospital one.
I liked the, I used the Tux pads, the witch hazel pads. Mm-hmm. That's like what felt, because I had a second degree tear both times, and that is what felt like the, on the perineum. That was the best.
So I tried to do all this yoga and stuff to like prevent the tearing. It doesn't really.
Oh, my kids' heads were too big. There was no hope. There was no hope for me.
No yoga would have taken care of that for you.
Yeah. No. And they didn't like. Yeah, I just felt like nothing. Even immediately postpartum, like nothing was explained. Like I got out of the hospital bed and they walked me over to the bathroom, and then they just like took off my gown, so I was just naked, and they had me like straddle the toilet, and then they just sprayed me with like a Perry bottle and like rinsed off all the blood and everything, and then they're like, okay, go get back in bed, and I was like,
there goes all like, you know how you're like, I feel like I'm like very modest, I'm like, oh no, nobody, it's like it's all out the window when you go to the hospital.
Well, and then I also so I felt very uncomfortable in my postpartum body. I've felt uncomfortable in my body most of my life, but like I really wasn't prepared for those changes in any sort of way, and I wasn't like, I guess the most change I was prepared for postpartum was the breast changes with breastfeeding, that they would like grow and change and that you would produce milk, right? I still had no idea what it would feel like. Nobody could ever really describe it to me, and my experience was very, like, I had severe pain. Like my milk came in hard and fast, like I think it was 5 days after the first time, and I just woke up and I had like boulders sitting on my chest, and they hurt and they were tender, and I couldn't get any milk out. Like I felt like they were going to rupture. But outside of that, like I wasn't ready. I really wasn't ready for like the pregnant belly that didn't have a baby in it anymore. Yeah. And like my skin felt kind of loose, and it was like it felt like cottage cheese or something.
To me, it was like Play-Doh. It was like almost like a jiggly, like
mine
Play-Doh.
Didn't even feel that
slime.
Firm.
Like slime. I feel like, you know, the kids play with slime?
Yeah.
It's like slime.
Yeah. Mine,
and I'm like, will this ever go away? Will it always be like this?
So mushy. And I just thought like, okay. And I had no idea of like a timeline for that to improve. Yeah. And it probably was like 4 or 5 months before I started feeling like a container again. Like my abdominal muscles had tightened back up, like shrank back down to normal size, you know, because they get so stretched out as the uterus grows. Not even like they were strong. They were just like back to normal tensile strength instead of like, I always felt like we played with silly putty as a kid. I felt like when you stretch the silly putty and then it's all like, that's how my stomach felt. And I just, I didn't bring non-maternity clothes to wear home. I went into the hospital in a maternity dress, and I came home in the same dress because I didn't want anything on me.
Makes sense.
And
I just wore the robe the whole time.
I didn't even bring a robe. It said to bring a robe, but I'm not a big robe wearer. I would love to.
I never wear robes.
I want to get into it, but I never got into it. It looks cozy. And
I got it for like one of a baby showers. I was like, I'll just wear this. I guess this is the best time to wear the robe. Yeah. And I wore it, and I mean, it was fine. It helped. Yeah. But I didn't expect to still look so pregnant the first time. Second time, obviously, you know what's going to happen. But the first time, I didn't expect to look so pregnant. And also, I thought when the baby comes out, the weight also goes away with it.
At least a lot of mine, I was 20 pounds lighter when I weighed myself when I got home from the hospital. Mm-hmm. But my baby was almost 9 pounds. So that was most of it. I did not lose that much weight after birth the second time. I think it was like
second
11,
time was harder for me too.
11 pounds. And I gained a little bit more weight the second time, but not by much, like 3 or 5 pounds more. But I feel like I looked a lot more pregnant at the end of the second time than the first time.
No, I definitely gained a lot more weight the second time.
And I knew what to expect, which was helpful as far as like no abdominal integrity at all. I'm like, you're like, oh, is that my stomach? Oh, maybe that's part of my liver. I don't know. But it was it took a lot longer for me to feel more normal again. Like it was like 6 months or so for my abdominal wall. And then, I don't know, by about a year postpartum, the first time I was back in my normal clothes, and I think I was like 4 pounds heavier than when I got pregnant the first time. And the second time, I think it took almost 2 years for me to get back to where I felt like comfortable in my own clothes. Like people would say like, oh, you're back in the same size. I'm like, well, look, I got it on my body, but I'm not sure I would say it fits. Like if I was in the store trying it on, I would have been like, no, this is too small.
It fits differently.
But I'm such an asshole that I was like, oh, you lost the baby weight the first time in 8 months or so. So I got rid of all of my bigger size pants because I was like, you don't need these. They're taking up space. I'm trying to declutter. So I just did that to myself. I didn't have any pants I could fit into for like a year because I threw out all the ones that were a size bigger.
I just accepted it. I was like, I will never go back to this size. I'm just going to keep my clothes this size and hope I don't get past that size, Yeah. But the second time I definitely gained a lot more weight, so that was a lot harder for me. But both times I did like the 1 hour glucose test.
Yeah.
Failed them.
Oh, you did? Both I failed times. The second one, not the first one.
I failed them both. And then I hate needles. Which is funny.
Yeah.
Needles on myself.
Yeah.
If I see like the needle in my arm where they're taking the blood, I will pass out.
Really?
I can't look at
let me
myself.
see what
I'm
you're doing
is this my arm?
I'm like, you're stabbing me? I want to be
I'd be the worst drug user. Yeah. But anyway, so then they did it and they're like, okay, well, if you fail the 1 hour, then you have to do the 3 hour test.
Yeah.
And I passed the 3 hour test the first time. And the second time, same thing happened. They're like, well, because you failed it with the first, you actually have to do 3 hour test twice.
No, thank you.
So I'm sitting in this like lab core. Everyone's fighting with all the people on the bottom. I'm like, I hate this so much. I wish like, what did I do? How did I fail it?
Yeah.
Both times. I don't know. But I was also very, very fat. So that could be part of the problem. I had I gained like 40 pounds the second time.
Yeah.
And
the second time I was in, they told me, oh, we're going to change the recommendations to only gain like 15 to 20 pounds for anybody. And
definitely
I was like,
that.
Good luck to you saying that to people.
Okay.
Yeah.
Like, when did you read? Well, I told you, right, about the guy that told me I was like overweight.
Yeah, I think we're just too weight obsessed in general. And,
I agree with you.
Like I said, I've never really been comfortable in my own body, and I wouldn't say I really care as much about like the number on the scale as far as like how I look and feel in my clothes, and so I have way more stretch marks the second time, which was a little bit upsetting for me because I didn't expect to have them because I didn't really have many the first time, and they were small. I had like one little cluster on the left side, and they went away not right after I gave birth, but they like healed up and went away. And the second time I had like so many more, and you can still see them, and now my skin is like a little bit loose. It's not. I think that if you like just saw my stomach with me like standing, you wouldn't necessarily know unless you were really looking for it or you have experience with like that loose skin. But it's like there's an old line from Golden Girls where they talk about like their skin getting old, and if you lean over a mirror and look at it, and they're like, oh my god, it looks like somebody let all the air out of my face. That's how I feel. It looks like somebody let all the air out of my skin on my stomach.
Same thing happened to me the second time. I got way more.
Yeah.
Way more. And then the whole, like, I was using all the body butters, like, all the, like, no.
I wasn't doing as much of that the second time. I tried everything. The first time.
And after. Like, bio oil, I did all that. Nothing really.
Yeah.
Really worked.
I'm hoping time helps me eat away
help
that
me
extra.
Forget. Actually, I hope time helps me forget.
What
is that? Who cares?
Yeah. And the pelvic floor stuff is the other thing I wasn't expecting. I think part of it is because they wanted, in the hospital, they told me to not breathe when I was pushing and push like you're trying to have a bowel movement and like shoot them out. And, like, that's not really I mean, it's not good for your pelvic floor, right? Because that just puts a lot of pressure down on it. And really, you should, I mean, if you want to be optimal about it, you should learn how to contract your core. Because what I was doing is I was blowing out while I was pushing the first time. And they were screaming at me to stop breathing. And
they tell you to hold your breath.
Guys, calm down. And I didn't even have a long labor. My first one, active labor, was probably 15 minutes. It was 6 or 8 contractions.
Oh, wow.
I remember thinking in the middle of it, I should have been counting these contractions.
My active labor was 3 hours because mine OB decided to have lunch in the middle.
Sure, yeah, that's great.
She's like, I have a lot, so I'm going to be back. And I was like, right now, ma'am? Right now is the best time?
There's like a head.
She's like, it's
breaking the plane.
I don't know. See ya. And then the nurse had to call her, like, can you come back? Are you done with
I would have
lunch?
been like, we're doing it without.
Because you have that 4-hour window. After that, they start, like, saying, okay, we have to do something else. So she came back in the last 30 minutes. She's like, either you push him out, or we're going to have to do something else. I still to this day don't know what something else was. But I pushed so hard.
Can I kick you in the face? Is that
so hard and so fast. Like, I think that recovery was longer, actually, than my second.
Did you tear?
I did.
Second? First?
First.
Yeah, the second degree is not great.
Actually, the epidural wasn't working for me. So as she was stitching, I could feel everything.
I never felt my stitches because I had epidurals both times. They didn't work great during the labor, but I didn't feel anything afterwards. But that recovery, like they don't really give you any. They don't. What they told me was don't look at it, and I was like, wow, that's exactly what I'm gonna go do. As soon as I get a mirror, I'm looking at it.
Well, they told me, like, do you want a mirror while you're pushing? I was like, I do not. They're like, yes,
you
do.
told me about that.
I'm like, I do not want a mirror while I'm pushing.
And
it is not a Beauty and the Beast little mirror like this. It is a long ass, full length mirror. They freaking roll that shit in,
window.
and they're like, now you can see everything. I'm like, I told you, Josephina, I didn't want to see shit, and you rolled in not just a small mirror, it's the size of that plant mirror. Yeah. I'm like, oh my God, like, this will help motivate you. I was like, now I feel really concerned.
Could you just give it that?
And I saw the top of his head. I was like, why is his head so small?
They had me touch my son's head the first time. Yeah, because I was in, like, I had pushed and then the contraction stopped, so we were stuck there. Yeah. And I could feel my vaginal opening, like, stretching around his head. And they were like, reach down and touch. His head's right there. You can touch it. And so I was like, I don't care. I just want to, like, can we get to the next contraction? Let's push him out, right? This is what I was thinking. Yeah. And they're like, yeah, you can touch it. So I was like, and I touched it. Okay, let's go.
Not comfortable. It's not a comfortable, like, pet to see at, like, the Baltimore Aquarium.
It's like a weird, like, they're all, they're covered in the vernix and the fluids. Yeah. And it was the top of his head, right? So it's just, like, matted hair.
I know.
Like wet, matted hair.
They're like, keep it on as long as possible. Keep his skin smooth. I'm like, can we bathe him?
I tried to, and they didn't listen to me. No. The second time they couldn't because he wasn't breathing, but the first time they were like, we have to check him. And I'm like, you can check him without cleaning off his whole body. I promise you that. And
they should listen to you. They should. Oh, well, that's great. They did not. I'm glad they'd listen. That's really good.
They said he wasn't crying. He was crying, but not like as loud as they wanted. So they were like trying to rub his back aggressively. But what they were really doing was wiping off, like cleaning off his whole body.
They were like, yeah, no problem. We'll listen to you.
I was like,
and you're like, I can see you. I'm not blind.
Yeah.
Maybe traumatized, but I'm not blind.
Yeah, exactly.
But I did like a lot of the yoga stuff too for like the core and all that stuff to start strengthening it back.
I had to do pelvic floor physical therapy both times. Wow. I was too tight the first time and then like too uncoordinated the second time. So I had to do different rounds. Well, my first...
How long does it last, the therapy?
Well, it depends because you can... Like, once you got kind of a good handle on it, if you're going to do it on your own, you can be released to do it on your own. But if you need somebody to guide you and make you do it, then you go for longer, so that you're getting it under control. But they tried to send me to a pelvic floor physical therapist, but they couldn't find one, like, in network close to me. And so they sent me to a place where they said they did pelvic floor, but the guy, like, clearly was not. He was just a general physical therapist.
He's like, this is on my roster today?
He acted totally cool, but I was like, I know you don't know what you're doing.
Because I say the same shit.
And, totally. Just make it up.
I told him. I'm like,
And he told me to have a glass of wine before sex so that it wouldn't be painful. Yeah, so that's when I knew it wasn't going to be a good fit.
Did he really say that?
Yeah, that was my first visit. Yeah, it was before we started.
Sir, I don't need that. I don't need my insurance to pay for that advice.
Yeah,
I do that already, but I need actual help. Like,
all right. I gotta go.
Yeah. You know what?
Yeah. So then
you get to have lunch early, sir. I'm out of here.
Yeah. So then I just rehabbed myself, and I came up with exercises for myself to do.
Wow.
And research some stuff, and yeah. So.
Wow. I'm sorry that happened.
Yeah, it sucks, but here we are.
Here we are. Well, you're good now.
Yeah. No, not totally, but
No?
I still have to do my pelvic floor rehab, and if I am not as up on it. What's tough is I think so I prolapsed the second time too, and so I have to be more cognizant of certain activities, especially if they're going to be prolonged. So for example at work, when I see a lot of patients, I have to really think about getting a good core contraction and pelvic floor contraction ready before I have to move patients around, so that I don't pee on myself in the middle of work.
That's good.
Yeah, and I don't leak. I don't have a lot of leaking problems. It's really only if I'm doing a sustained, difficult, or high impact activity.
Because you hear it's pretty common. People laugh too hard, right? It happens to them. It can definitely happen to me sometimes if I'm laughing too hard. So
yeah, I mean, what's sad is they always. What I think is sad is the advice you get, especially at your 6-week postpartum, is yeah, that's common. And what's I think mistranslated is they either say common or normal. And I think a provider might say normal, meaning it's normal at this time that your pelvic floor isn't fully healed. But what patients hear is, oh, it's normal. I'm going to pee myself for the rest of my life.
Correct.
Because they don't know that there are things they can do. I've even told people, you can train your bladder. And they're like, what does that mean? And so I tell them, well, especially with urgency and frequency, you can start to use timing intervals to train. When you feel the urge, you can hold it for, 5 more seconds and then go, and then 10 more, and then 30, and then up to a minute. Because the problem with the bladder is the more frequently you empty it, the more frequently you'll feel like you have to go. And then that's why people get stuck in this cycle.
I think communication has to be more clear with us.
Yeah. And then providers are thinking I see this stuff all the time. So I know it can get better, but patients don't know that. And then you're not given any resources, and no one explained any of this stuff to you in the first place, that you might have pelvic floor problems.
Who was that one person we had interviewed, and they said they weren't able to walk, and they told them that it's normal, but actually the pubic symphysis had,
that was Jenny.
Yeah, had, what I mean, separated. I didn't even know that was something that could even happen.
Oh, yeah.
I didn't even, you can think about it, but, I never heard someone actually diagnosed, with something
like that. That's
awful. Crazy.
It sounds awful.
How many things, I don't know. Yeah, that's just,
well, that's what I think happens with the pelvic floor stuff too, right? I think
you're right, yeah.
Especially tightness, because tightness I find is a bigger problem for people than weakness, because they don't know what to do. They don't know how to relax their pelvic floor, right? Because and tightness can be mistaken for weakness, because when your muscle is tight, it's going to be weak, right? If I told you to hold something out in front of you for 45 minutes, and then asked you to pick up something heavy and you couldn't do it, it's because your arm is tired, because you were just doing this thing. And that's what's happening with the tightness. You're tight all the time. So then, of course, you can't do a full Kegel because your muscles are weak, because they've been just squeezing all the time. So then you're told, oh, your pelvic floor is weak, even though you have symptoms of tightness. So then you make it worse, because you're trying to do Kegels, you're trying to do these strengthening exercises, but you're just fatiguing it more and more, because you can't coordinate those. And you're not going to get the strength, because they need to be able to relax before they can fully contract and coordinate.
Way more information afterwards. Way more about anxiety, depression, physically things that we need to do to strengthen ourselves. We have no information.
Yeah,
and we end up walking around what's going on.
Well, you couple that on top of popular media or even social media, people portraying what they look like postpartum, or how they're feeling postpartum,
the matching sets
or not. Yeah, and then you think this will be for me, or. Even that, what was it, that popular show, Selling Sunset? Did you ever watch that? Mm-mm. Well, one of the women has a baby on it, and then she comes back, and you see her, a week later, and she's model skinny again, And they're like, I can't believe you just had a baby. And she's like, oh, yeah, I just had a baby. Everything's fine. She's doing upside-down yoga. She's on her head, and her legs are all spread open.
That sets up an expectation for people, and that's not
realistic.
What I'm saying.
And that's part of the problem. So then you see that, and you're like, well, I used to be thin, and then now I can't lose the weight or whatever. And we don't talk about the different hormones, or the stress, and then not sleeping and feeding another human, and all this stuff that goes into maybe reasons why you're not losing weight, or we've set up this whole society around women are valued based on what they look like.
True.
Sort of thing. And then you've got your own upbringing for however you perceived your appearance or your body image. And it's just no wonder we have these huge significant problems that are lasting for people. And like,
especially mental health, because that all plays into mental health. When you think you're supposed to look a certain way and you're not, and if you feel as yourself, I'm failing at this. And there's also not even body image things. There's things with your kids that people feel like they're failing at because social media portrays a certain thing. Even though technology is great, I think in the aspect of that, we're creating more unhappy people because we're having expectations that are not realistic.
Yeah. And even like, so I feel bad complaining about my postpartum body because I'm back down to my pre-pregnancy weight, but I don't feel like my body functions the way that it used to or the way that I want it to. And I know I can't trust it to do certain things yet. And then I have to work on those. And that's frustrating for me. But nobody wants to hear that when they're like, well, I've been trying to lose 50 pounds for 3 years.
But there's a lot of aspects,
and that's,
right?
Right. And like,
we focus
for me,
on weight.
I don't feel comfortable or confident fully in my body yet. And I'm still 2 years postpartum, right? Like, and that's what we don't talk about because a lot of people say you're not still postpartum. Your kid is too.
No, it's there for a long time. Like even there's times where I wouldn't even look at pictures of myself for a while.
I didn't want to be in pictures. I told my husband
try not to
put
be in pictures a lot of times.
And then he would send me pictures, or he'd send pictures to like his parents of me with the kids, and I would be mad.
I don't want to be. So I realized for 6 months after my daughter was born, I don't have one photo of myself.
Yeah.
I took photos of everyone else with her but me because I realized to some extent I didn't want to be in the photos.
Yeah, I don't want to see myself.
And how sad is that you miss out on those times because you're so worried about the way you look.
Yeah.
And I think society has built it that everything is on the way you look.
Yeah.
Your success is tied to the way you look. Everything is tied to the way that you look. And
I think there's more expectations placed on a woman before she opens her mouth than there are for men. Like just based on appearance and what people see. They expect you to be a certain way. And it's like, oh, okay, cool, great, well, good talk.
Well, a lot of times they're not even like, a lot of times you just suck it up and you internalize a lot of things because you're like, I don't want to say things.
What is he going to do? Yeah. Not everyone's going to listen. And how is it going to be helpful in this situation? It's not always helpful. It's not always the right opportunity or the right moment. And so like, you have to just persevere.
Yeah. Yeah, that's true. But I think we should speak up more for ourselves. I know for myself, like postpartum, I didn't speak up as much as I should have. And if I had spoken up more, like maybe I would get a better understanding. But I feel like I was just like, no one's really going to listen. No one's really going to care. And let me just move to the next step. Let me just move to the next step. And I think that also plays into like body as well. Like, hey, this is happening to me. Like I'm peeing on myself. Should I tell anybody? Should I not? Who cares? Like, let me just keep going. They say
I have a lot of patients that don't want to say stuff like that, right? Like, and then I'll ask them questions, and then they'll be like, "Well, yeah, I pee sometimes," or like, especially like bowel incontinence. People don't want to talk about that.
Yeah,
which it's embarrassing, and I get it.
Yeah,
but like nobody's gonna help. I remember when I went, I had a urogynecology follow-up because I was having some bladder issues. And one of the questions said, do you need to insert your fingers into your vagina to have a complete bowel movement? And I said, excuse me?
I do not think
that is happening to people. I was like, oh my God. And then
how common is it happening? This is on the...
Then I was thinking, would I even know to do that? Like, is your body telling you, like, you got to push it out from the inside? You got to get in there and push it out. It was on there like 2 or 3 times in different sections, and I was like, God, what? Like, you don't need to. You got other people. You got to treat. They need.
This seems like
they need help because that's not okay. Whatever is causing that, I'm not on board.
How many people are doing that? This is on the. You know how like there's like common genetic like disorders they can test you for when you're pregnant. Like the fact that it's on the questionnaire when you walk in.
Exactly. That's what I'm saying.
It made it
like
to
the third question. I was like, no. I'm not okay.
What?
Yeah. They make like wands, so you don't have to put your fingers in.
What is happening right now?
The shit is messed up. Is what's happening, and nobody knows
that
these are things that can happen. Yeah, truly, can't get it out. It's usually a prolapse or a tear issue. So like a tear in one of the muscles, and you can't void, or you're having a rectal prolapse. So pelvic organ prolapse can be vagina, bladder, or rectum falling into the wall. So prolapse means it's falling into the wall of the vagina. So then like you usually can see a bulge, like not always, but you can sometimes see a bulge like coming out of the vagina because now the wall of the vaginal wall has been collapsed because the organs are supposed to be up and supported in your pelvis by the pelvic floor. Yeah. And they have come through the wall, or the muscles aren't strong enough to hold the sling anymore and they're falling down. And so sometimes when it's the rectum, it's kind of like a kink in the hose because it's fallen into the vagina. Now it's not open enough for the the stool to transit.
You're right, though. I don't know. I wouldn't know what to do if that was me.
Yeah. I don't know if I'd go talk to a doctor about it. I guess I just hope to God I could figure it out. Yeah.
I don't know what I would say. Yeah, it's true. I get that.
Yeah.
I would be really... No, I don't know. I don't know, actually.
Yeah, I don't either. But I was like, well,
I didn't even go to my 6-week follow-up, so...
Why not?
I don't know.
The first time or the second time?
Both.
Oh, really?
Never went.
Huh.
I was like, you know what? There's enough people that have been inside me. I'm pretty much done with this.
Yeah.
I don't want anyone else to check me. I'm okay.
Yeah, it's truly.
I was over it at that point.
Yeah. And one thing I was going to say earlier when you were talking about, like, modesty goes out the window.
Yeah.
I had a dermatology appointment, I don't know, a couple months postpartum, and they had to do the full body check, right? Yeah. And she made some comment about, like, they give you this, like, I don't even know what paper sort of gown.
Is like the best?
It was like a gown. It was almost like an apron.
But was it open in the front?
She said open in the front or the back, like whatever I wanted. Oh. But like they end up taking it off anyway because they look at your whole skin, right? And I was feeling very uncomfortable because I still had my like postpartum belly and it was all soft and squishy and yada yada. And it was the second time I was postpartum in the summer, which I 10 out of 10 do not recommend. It was Definitely so hot. None of my clothes fit. I hated everything. And
I cut all my hair off during that time.
I went and she was like, oh, yeah, well, you can just take it off. And she made some comment about, like, you've given birth before, so, like, you know, like you
don't care.
Yeah, exactly. Like, it doesn't matter. You know, you've been through it, so you don't. And I almost said to her, like, oh, yeah, I've been traumatized once. So why not do it again? And I just, I probably would have cried if I had said it, but that's what I was thinking. And I was just like, yeah, sure, I'll just stand here naked in your office. Feels great.
That's what I felt the other day. I went for I call the office. I'm like, I'm due for a pap smear because you can't get them when you're pregnant, right? Mm. So I go and I call and I'm like, am I due? Like, yeah, you're due. The front staff tells me I'm due. So I go in there. I'm like, oh God, I hate this. I don't want to go through this. So I go in and she goes, oh, you're not due. We only do like every 3 years. You don't have to come.
It's literally changed every single time I've had one.
Yeah. No. And then she goes, but we can still check you since you're here. And I'm like, damn it, I don't want this. If you let me walk out, it's the same thing. Mm-hmm. They did the exact same thing except there's no scraping. That's it. Really? She got the whole speculum out. She got everything. Yeah. I was like, great, this is wonderful. And I'm in there like trying to cover myself, and as I'm covering myself, it starts freaking ripping.
Oh, cool.
I'm like, just whatever.
I hate getting
just
down.
Just get it off.
I hate scooting down to the edge of the table. They're always like, keep coming. I'm like, I'm going to run a table. Like,
I'm going to fall.
A little bit more. You'll get there.
It's like a little pressure, and I'm like, a lot of pressure.
Yeah.
Or when they take it out, like, this is just the speculum. And I just like imagine like Frankenstein's table and it was like going up and when I hear the noise, I'm like, do you have to do this though? Could you just tell me I'm fine?
Yeah, I guess not.
No, they did the whole thing.
I mean, my second 6-week one, when I was telling him I was having all these problems, he said, do you want me to examine you?
No.
And I was like, what?
Actually, no.
Is like, I mean, do I want you in my lady bits? No, but maybe
if I'm telling you there's an issue
check
there,
out
you should
all
check
the stuff that's happening.
He's like, I don't want to do
like
that.
Present some sort of medical opinion, as is your job, sir.
Yeah. You're like, I don't know. I don't know how to answer that right now.
Yeah. So no. Okay. All right.
We should go to more female physicians.
Yeah, I mean, I do keep trying to give male providers a chance, and most of them keep disappointing me in the same manner. And
my high-risk one really disappointed me. And he was like the owner of the practice. And I was like, anybody else? But I don't care.
Yeah.
He told me I'm fat. I need to get out of here.
Yeah. It's not,
do you know you're overweight?
Is that healthy?
Oh, no, I don't know that. I don't own a mirror.
Yeah.
Thank you for telling me, sir.
I'm making a human. Did somebody
Can I get my copay back? Because
is that written in my chart that I'm making a human right now?
I'm coming to you to make sure the baby's growing, and you're telling me, oh, she's growing, but so are you. So make sure you don't grow anymore, and she does.
Yeah, I'll get on that.
Thank you. Anybody else here?
Yeah.
So I started seeing his, like, whatever associate who's also pregnant. So
perfect. Better.
We're both out at the same time, but
I got it.
But I had patients that were seeing the same provider, and he was saying the same thing to them.
I have patients that come back and go, oh, well, I went to my primary or an orthopedist or whomever, and they said the same thing you did. Yeah. I told you what you had. I told you I explained the problem to you fully. I did, yes.
Oh, they say it to me all the time.
And I'm
like we hope you don't, but I went somewhere else. And
no one apologizes to me. They're just shocked that my opinion was the same as some other guys.
And sometimes they'll be like, really, I'm like, you know what? If you feel like that's better, you should go there.
Oh, yeah, totally.
You don't need to see me. It's okay. This woman had I've been seeing her for years. She broke her toe. Mm-hmm. She goes, I went to the surgeon. I was like, wasn't me. So where'd you go?
Yeah.
And she's like, they told me it's fine. And I just went home, and now I'm still in pain after 6 months. I was like, just wanted to let you know that on my card it also says foot surgery.
Yeah.
You could have come to me, but you didn't.
Yeah.
And now I have to deal with this mess.
Yeah.
Thank you so much. Thank you, ma'am.
I'm just going to actually cut your toe off. Don't worry. You don't need it. You don't deserve it.
Start grabbing the shit out of it out of nowhere.
Yeah. Good luck, everybody.
Oh, my God. Ugh. That was good. Like that one?